November is Diabetes Awareness Month, a time to focus on prevention, early detection, and healthy living, especially as we head into that indulgent holiday season. Joining us today is Justina with Omni Family Health to share insight on understanding the different types of diabetes, managing stress and diet during the holidays, and how Omni can help patients stay on track with their health. Hello.
Hi, how are you?
I'm doing good. It's great to have you back.
Great to be back.
Are you ready for the holidays?
Look, not yet, but it's coming, it's coming.
It is, it's rolling rapidly, which I think this is why it's so important to talk about this. I mean, a lot of people are hearing about diabetes, but I feel like a lot of people don't know there are different types. So could you explain the different types?
Yes, there are different types of diabetes. So typically people are familiar with type 1 diabetes, type 2 diabetes, gestational diabetes, but there are other classes of diabetes like the latter diabetes, which is latent autoimmune diabetes in adults. There's also MODY, maturity onset diabetes in the youth. And then of course there's also diabetes caused by other things like drugs, maybe increased use of steroids for certain things, or like pancreas diseases and some other autoimmune conditions that can predispose one to diabetes. So we do have a lot there. Some are common but just not known, but the three main ones are the ones that you just kind of hear all the time.
Yeah, I don't think I've ever heard anything past one, type 2, and then gestational diabetes because I've had kids.
Yes, and it takes a lot of kind of screening and just, you know, knowing patients, your history and stuff like that to get into the other ones as well.
Now this month we're celebrating Diabetes Awareness Month, but it's also kicking off that holiday season. So why is this an especially important time to talk about diabetes prevention and treatment?
You know what, the holiday season, the fall season, festivities, Thanksgiving, Christmas, you know, New Year, and also it's also the season where it gets darker, it's cooler, and so a lot of times people go through stresses of the holidays, gift buying, traveling, and also it's cooler, so we're more sedentary, we're not doing a whole lot, financial stressors, so it's very important that we plan adequately, you know, ahead of time. So when that time comes, you know, things are just
rolling along.
Exactly. And then just being intentional about moving, even though you just want to sit on the couch, drink some hot chocolate, chill, Netflix, but staying active during, you know, Thanksgiving festivities, meeting with families, instead of just playing board games. Maybe you can incorporate activities that, that involves movement, you know, activities that involve dancing or something that gets people out. And I always talk about the 3 Ps, you know, start your day with a protein, pace your meals, and physical activities, you know. And so those are some of the things that I think, you know, people can do to just kind of help them better during the holiday period.
You know, and I think the meal planning can be especially difficult because this is a time where we tend to overindulge and we have a lot of stuff and we don't think about it. But if you are somebody who, you know, you have diabetes, you've been diagnosed, you have to properly plan either your medications or your meals out or both.
Absolutely. I always say one thing you don't want to have is the diabetes police on the table where you're trying to eat and they're like, oh, you have diabetes,
you can't
eat that.
Yeah.
You know, we don't want that. So we say make appropriate planning in the foods that you put on the table. So everybody's enjoying healthy options and enjoying family, friends, and also the holiday season as well. So just being intentional about what we pick, what we choose, the drinks we get ready for the holiday for.
Now, what about people who maybe haven't been screened for diabetes yet and maybe it's lurking and they have no idea? How often should someone be getting screened for this?
You know, Caitlin, there is over 8 million people that have diabetes and don't even know it.
Wow.
And a lot of times I have patients that are like, oh, I didn't feel good. I went to the emergency department and the doctor is like, how did you get here? Because my blood sugar was so high and I didn't even know it, right? So it's as simple as a blood draw or a finger stick. And it's very important when you have your annual physicals, you get screened for this, we catch it early, we get your family history, because you know what, when you have a family history of diabetes, it puts you at risk.
Right.
So for example, my mom has diabetes, her sister, my grandmother, it already puts me at risk. So screening and engaging in those lifestyle changes, lifestyle modifications and stuff like that would definitely help you prevent diabetes or even at least decrease how soon you
Decrease the
get it.
risk, yeah.
Yeah, absolutely.
So, I mean, this is especially an important reminder to go get those annual screenings and make sure all of those tests are being done on you every year. So if somebody needs their screening, which they probably do, how do they
Yes.
get an appointment?
You know, at Omni, we have a lot of clinics. Getting an appointment with one of our providers, you get screened, you get your risk factors assessed, you get a game plan, you talk to the providers, nurse practitioner, doctors, physician assistants, and you come up with a good plan that works for you, whether it's lifestyle modifications only or maybe pharmacological interventions. You talk together and come up with a very good game plan. We have a number on the screen, and we also have texting options where you can make an appointment or even walk in and have those screenings done.
That's my favorite part. You can call, you can text. There's so many ways to get there. So there's no
Yes.
excuse not to, friends.
Absolutely not.
Well, thank you for joining me, and happy early holidays.
Happy holiday. I hope you made your plannings.
Yes, I'm planning my food out, I promise.
Awesome.
And with that, we're going to take a short break. We'll be right back.